Everyone, welcome to MEDx channel. Today we are going to talk about diabetes mellitus. Diabetes mellitus, it is an endocrinal disease that is characterized by increased glucose blood level. It can be divided into two major types: type 1 and type 2. Type 1, it is usually due to autoimmune disease. There is antibodies against pancreas causing pancreatic fibrosis. So the insulin level will be reduced, and it is associated with other autoimmune diseases like thyroid hypothyroidism and systemic lupus and the other autoimmune diseases. What about type 2? Type 2, it is due to insulin resistance. As there is a lot of insulin, but this insulin is not effective, as it can't causing the glucose to enter the cell. So insulin level will be increased. So if I wanted to differentiate between type 1 and type 2 by lab, I will search for C-peptide. C-peptide is a protein that binds to insulin. If C-peptide is decreased, so it will be type 1. If it is increased, so it will be type 2. By the way, type 2 on the long run will be converted to type 1, as insulin resistance that the peripheral tissue can't receive blood glucose. This will make pancreas to secrete more insulin, and this will cause exhaustion of beta cells, make it to be fibrosed. So on long run, type 2 will be converted into type 1. As we mentioned before, that pancreas has a lot of cells. Alpha cells secrete glucagon that increase glucose level in the blood, while beta cells secrete insulin. Delta cells secrete somatostatin. Somatostatin inhibit both insulin and glucagon from beta cells and alpha cells. So when there is fibrosis of beta cells, there will be insulin type 1. Or when there is exhaustion of beta cells due to insulin resistance, beta cells will be exhausted due to multiple increased insulin, and it will convert it into type 1. So the treatment of type 1 is mainly by giving subcutaneous insulin. It can be twice daily, but it is not physiological. Or 4 times daily by technique called basal bolus, which is more physiological. What I mean, it is more physiological, as when I eat a meal in the breakfast, my body secretes insulin to be peaked like that, and there is a basal insulin to be like that. So every meal I got, there is a peak of insulin should be secreted, while there is a basal insulin that is secreted all over the day. So in the dinner and the breakfast and the in-between meals, so it will cause increase in insulin by peaks, and there is a basal insulin in between. Okay. What is the treatment of type 2? Type 2 treatment should be with a lot of things like sulfonyl, urea, and metformin, SGL2 inhibitor, and GLP. Those drugs helps to decrease blood glucose level and causing increase in the peripheral tissue to be more receptive of insulin. The most important one is metformin. Metformin act by increase insulin sensitivity in the peripheral tissue and make the beta cells to secrete more insulin, but it has a lot of side effects like vitamin B12 malabsorption, and it is contraindicated in patients with metabolic acidosis, as it causes lactic acidosis. But metformin is the most important drug in type 2 diabetes, and in type 2 diabetes I should use the combination metformin with sulfonylurea or metformin with GLP, metformin with SGL2, but metformin should be the cornerstone in the treatment of diabetes type 2, and it is most important. By the way, metformin will not cause hypoglycemia. Sulfonylurea, it has a great side effects that it causes hypoglycemia, but it is still used because due to it is cheap. If the diabetes type 2 it is aggressive and cause exhaustion of beta cells, I should give those drugs, not all of these drugs, combination of 2 or 3 of them. Okay, metformin with any other drug plus insulin, as there is exhaustion of beta cells, so no insulin is secreted. So when there is no insulin, metformin can't increase insulin sensitivity because there is no insulin, and metformin can't stimulate beta cell to secrete insulin because there is no insulin. At its beta cell, it is fibrosed. Okay, So I should use any combination of them plus insulin. All of those can cause hypoglycemia except metformin. Okay. Diabetes on the long run can cause multiple side effects. It causes glycosylation, and this glycosylation can cause renal failure, multiple organ damage, by the way, renal failure, retinal detachment. It can affect the other organ. It can cause damage to peripheral nerve. So patient with diabetes, uncontrolled diabetes, and has MI, for example, the patient will be dyspneic, but there is no chest pain, so should be missing. So every high glucose level I should do ECG to exclude MI, as sometimes there is a stress response, so the blood glucose level will be increased, and the patient can feel the pain due to damage of the nerves that causing pain. So there is no chest pain, but there is increased blood glucose level, so I should do ECG to exclude silent MI. Thank you for watching this video. I hope you got benefit from this video. Don't forget to like the video and subscribe the channel.